Okay, we're here with Paul Thomas, an infection preventionist with Ministry Healthcare at Ministry St. Clair's Hospital in Weston. And Paul, obviously, the holidays are in the rearview mirror. Friends and family have gotten together, but in a lot of cases, a lot of germs and other things may have left behind. As our, really influenza season, we've seen a lot of whooping cough early in large amounts. And now it seems like the influenza season is really picking up for us. What's kind of the current status of both patients and in our communities? How much flu are we seeing?
We are seeing a lot of flu. As of December 15th, we've really seen flu cases increase weekly. Lots of flu in our community presently.
And I suppose people getting home for the holidays, getting together, and now kids getting back to school. Those are all just kind of, I don't want to say germ factories, but way that people in close quarters. Talk a little bit about how influenza and the flu is spread and what people should be conscious of.
The flu virus definitely can be spread person to person. So when you're having those holiday get-togethers, when someone is coughing or sneezing or speaking, tiny droplets exit the ill person's lung. And as you inhale those into your body, you can get sick. Another way of getting the flu is picking up the virus from contaminated surfaces, such as doorknobs, keyboards, cell phones.
Your kitchen, I'm sure, things like that.
Things that you frequently don't clean can be very contaminated. And then when you rub your eye, when you rub your nose or scratch your teeth, that virus can get inside your body and create the flu.
Once that virus does get inside your bodies, what are some of the common symptoms that people most often will see?
Flu patients will describe a severe illness. High fever, muscle aches, coughing, generally not a productive cough, but the malaise or being extremely tired. You definitely know you're sick. This is different than the common cold, where you may have a runny nose, you may have a productive cough compared to the dry cough with the influenza. Generally no fever with the common cold, but definitely a fever and illness present with the flu.
Obviously, the Centers for Disease Control and Prevention and healthcare providers always say the yearly influenza vaccine is one of your best prevention things to prevent the spread of the flu. Is it still too late if people, sometimes it takes their community to see a bunch of cases to say, this is something really I should consider. Is it too late for people to get their flu shot?
It's not too late. Ideally, you want to get the flu shot, which is given in the form of an injection 2 weeks before the first case. Now, we're already past that point. There are still benefits for getting the flu shot now and preventing future influenza illnesses.
Lastly, what are some of the quick basic things you could tell people? What if there are 3 or 4 things to do that are absolute must-dos to try to prevent the spread of these germs and the flu virus? What would they be?
When you're ill, isolate yourself. Don't report to work. Don't report to school. Cover your cough, not with your hands, but using your elbow. Generally, hands, people shake hands all the time and can spread the germs. We don't shake elbows. And hand hygiene, either using an alcohol-based hand sanitizer or the good old-fashioned soap and water to remove those germs from your hands so you're not bringing those germs to you or bringing those germs to the people you're with.
Okay, Paul, thanks for some good advice here today. I know we're going to talk through some other things throughout the next couple of weeks to try to keep our community safe. And don't forget, you can visit ministryhealth.org/flu season for all the latest information.